Does your dog suffer from itching, allergies, or any other inflammatory skin condition? If so, you need to be watching this video as we are going to cover a new treatment option on the market called Zenrelia. I'm Dr. M. Welcome to VMC. In the video, we will be taking an evidence-based look at Zenrelia, discussing how it works, how it compares to other treatment options already on the market, what symptoms and what side effects you should be aware of, and most importantly, whether or not you should be even considering this as a treatment option for your dog. Join me, you'll learn something today. This new medication is going by the brand name Zenrelia, and it falls under the class of medications that are JAK inhibitors. This class of drug will block cytokines that are in your dog's body. Now, cytokines are a kind of chemical that are involved with things like inflammation, itching, but they are also involved in the immune system and involved in how our animals grow, among a bunch of other things. Essentially, cytokines help to regulate a number of different aspects of our bodies. If you've already watched my previous videos on environmental allergies, i.e. atopic dermatitis, then you will have already heard about another medication that is in the same category, and that is called Apoquel. Now, the benefits for Zenrelia is that Zenrelia is only given once a day, and it is most often less expensive. Apoquel, on the other hand, starts out being given twice a day and then it does go down to once a day. The problem with this is that a number of patients will experience some of what we call rebound itching once their dose decreases to once a day. With Zenrelia, we avoid that issue, which is wonderful. So next, let's cover the research that we have about this new medication. There were 2 studies done in the US. In one of those studies, they took a cohort of dogs that had the diagnosis of atopic dermatitis. This is the most common allergy that veterinarians see in practice. In the other study, they took dogs that simply were itching. It didn't matter if the dogs had a diagnosis of atopic dermatitis or not. If they had another issue that caused itching, say like a flea allergy, a food allergy, or some combination of all 3, those dogs were also allowed into the second study. Both studies lasted for 4 months, and all dogs did have to meet a minimum itching criteria in order to enroll in the first place. The results of both of these studies showed that the dogs did have a significant improvement in the amount of itching that they experienced. This was better improvement than the dogs who received a placebo. And this significant improvement was defined as having at least a 50% reduction in their itching. The third research study that we have on Zenrelia was done in Europe. I loved this study because it was a head-to-head comparison between Zenrelia and Apoquel. There were over 300 dogs enrolled from a number of different countries, from a number of different veterinary clinics. The conclusion of this study was that Zenrelia is not inferior to Apoquel. The reason this matters is because if we already have an option on the market that will end up being better than Zenrelia, then there isn't a point to having Zenrelia for most situations. But if we are demonstrating that Zenrelia is at least as good or maybe even slightly more effective than Apoquel, then that does make it an appropriate option to be carrying in vet clinics. In this study, 77% of the dogs that were given Zenrelia were deemed to go into what we call remission, meaning that their itching on the scoring scale was a 2 or lower. Now, some of you may be wondering, well, why does this even matter? We already have a number of different treatment options that are already on the market to manage itching and help dogs that are dealing with allergies of all sorts. But I'm here to tell you that even with all the options that we do have, there are always some patients who either have side effects or who just don't respond as well as we want them to. Often these dogs end up on multiple treatments. This can be expensive. They will have more breakthroughs of flares of itching. This also means that they're more likely to deal with more secondary infections. That means that they end up being on additional medications for those infections more often, and those difficult to manage situations are heartbreaking for everybody and very frustrating. I did cover the other treatment options in my previous series on atopic dermatitis. I will make sure that it's linked in the video description for you if you happen to miss it. If you haven't lived with a dog that deals with allergies, you may not realize just how disruptive, persistent, intense itching is to the quality of life for both the animal and the people living in the household. The itching and the licking and the sleep disruption and the discomfort and the pain are just awful. And since Zenrelia reduces inflammation in the skin, in theory, that means we may also deal with fewer secondary infections. And considering this from antimicrobial stewardship perspective, that's also very valuable. The less often I have to prescribe antifungal and antibacterial medications, the better. So at this point, you're probably saying, well, this all sounds great, but here's where we move on to the things you need to be aware about and consider and look out for. Just like every single medication that is actually effective, there are side effects with JAK inhibitors. Do keep in mind that the risk of side effects is lower than the risks for dogs who are on, say, steroids over the short and long term. But that doesn't mean that there are none, and you do need to know about them. The big elephant in the room that many people will have been talking about is that there is a black box warning on the Zenrelia medication surrounding vaccinations. Let me read the warning on the box a moment. It says, based on the results of the vaccine response study, dogs receiving Zenrelia are at risk of fatal vaccine-induced disease and inadequate immune responses to vaccines. Discontinue Zenrelia for at least 28 days to 3 months prior to vaccination and withhold Zenrelia for at least 28 days after vaccination. Oof, right? That's pretty scary. So let's dive into the study that caused this black box label to appear on this medication. After all, a simple way to think about an allergy is that you have an immune system overreacting to some sort of stimulus, whether that is pollen or chicken or fleas. Zenrelia helps to reduce the immune system's hyper response to allergens. But because we know that it interacts with the immune system, it makes sense that there is a research study that was done to see if there would be any interactions that we as veterinarians need to know about when we are vaccinating our animals. We rely on the vast majority of our dogs to mount a sufficient immune response to their vaccines. This is crucially important. So in the vaccine safety study, there were a group of beagles that were supposed to be kept in a biosecure facility. Now, the population of dogs that was used for this vaccine safety study are not the same as the population of dogs in the real world that we would be treating with Zenrelia. First and foremost, there were 16 10-month-old beagles. We are only meant to be using medications like Zenrelia in dogs that are over a year of age. So already there's one issue with this study. These beagles were also completely unvaccinated. So in the real world, you would be using Zenrelia in animals that had already received their puppy series. Now, they attempted to make this research study more controlled by having the beagles grow up as a group in a biosecure facility. This way, we are trying to guarantee that the beagles will not have been exposed to any infectious diseases prior to being enrolled in the study. So the way the study was designed, the researchers tested the dog's titers or antibody levels to a number of different viruses that we vaccinate for. They did this 3 weeks prior to, and then again immediately prior to starting either the placebo or Zenrelia, but at 3 times the labeled dose. And they gave this placebo or Zenrelia for a total of 3 months. The first vaccines were given 28 days after the beagles had started Zenrelia or the placebo. And then they were given a booster 1 month after that. The titers were checked again on day 60 and day 88. Then at the 3-month mark, they discontinued giving the placebo or Zenrelia to these beagles, and they continued to check vaccine titers at 4 months and 6 months after the research study started. They also tracked metrics like body weight, blood work tests, urine tests, and some other immune markers like T helper cells. Now, the research results were not what we would have been hoping for. This is because of a few different variables that we will talk about. 1 month after the dogs had received their first vaccine, they had their titers checked. And the dogs that were in the placebo group and the dogs that were in the Zenrelia group both had inadequate responses. 2 months after their vaccines were started, some of the dogs did have an adequate response to the vaccines, while others continued not to. 3 months after their vaccines were started, so that would have been 1 month after Zenrelia had been stopped, the dogs were checked again. And at this point, they all had an adequate response to their DAP vaccine. However, one of the placebo dogs and one of the Zenrelia dogs had an inadequate response to rabies. So then the question becomes, why did all of these dogs, including dogs in the placebo group, have an inadequate response to their vaccines? Now, it could be that some of the dogs that were receiving Zenrelia had their immune system impacted by the drug given at 3 times the labeled dose, and that was a factor for why they didn't respond well to their vaccines. But this does nothing to explain why the placebo group dogs also had an inadequate response. So when you're reading the research study, what you find out is that unfortunately, the facility these beagles were being cared for in, they were living as a group of dogs in this facility. It was supposed to be biosecure. It unfortunately was not biosecure, as the dogs came down with coccidiosis. This is a GI parasite that can cause diarrhea and make animals quite ill. And some of the dogs were showing symptoms before they received their first vaccines. Because the placebo group and the group receiving Zenrelia were all living together, and coccidiosis is quite contagious, this disease was spreading through the group of dogs. Some of the dogs ended up with milder symptoms of coccidiosis. Unfortunately, 2 of them got so ill that they ended up needing to be humanely euthanized. So the dogs that were euthanized did undergo a necropsy, which is the dog version of an autopsy, so that the researchers could get additional information on why these dogs were getting so sick. On necropsy, it was discovered that one of the dogs that had been euthanized had a severe hepatitis or inflammation in its liver that was caused by canine adenovirus type 1. Now, it's important to note that this is a different virus than the one that we vaccinate for. So why then, on the Zenrelia box label, does it say vaccine-induced fatal disease? The researchers did not find out that it was actually a different adenovirus type until after the FDA had already looked over the findings up until that point. Canine adenovirus type 1 is also an incredibly contagious disease, and since this group of beagles were all living together, it means that there will be other dogs in the group that also were infected with it. This is an appalling thing to happen in a supposedly biosecure facility. They had not 1 but 2 separate infectious diseases spreading between these dogs that were meant to be kept away from any potential infections. So it's not a surprise that we had so many dogs not responding adequately to the vaccines that they were given. Now, of course, the FDA couldn't ignore the research information that they had at the time when they were going through the approval process for Zenrelia. It was responsible for the company to do a research study on vaccine safety, and it was the right thing for the FDA to do to not ignore the information we had at that time about that study. But what we need to remember is that this situation shouldn't occur in real life. If you bring your dog to your veterinarian and they have any signs of illness, your veterinarian wouldn't be giving vaccines to your dog at that time. We're not supposed to administer vaccines or boosters to animals that are sick. This is one of the many reasons why physical exams before vaccines are so important. We are looking for any signs of feeling unwell or being ill, because in those situations, the immune system is already fighting whatever that dog is already dealing with. So we don't add a vaccine on top of that. One, we don't want to make the dog more sick by giving their immune system another thing to deal with. And two, we know that the chances are the dog won't respond properly to that vaccine because their immune system is already fighting an illness. So once we knew about all of the issues that were in this first vaccine safety study, a second study was undertaken in order to get more accurate results about what the impact of Zenrelia alone would be, in the hopes of having a research study that didn't have so many complicating issues happen within it. This second study was presented at the International Society for Companion Animal Infectious Diseases. This study involved 68 healthy dogs. These dogs received a vaccine booster at 10 months of age, and then they were started on either a placebo, the label dose of Zenrelia, or 3 times the label dose of Zenrelia. After the dogs had been on Zenrelia for 28 days, the dogs received vaccine boosters. Their titers were then rechecked 2 weeks after vaccines and a month after vaccines. In this research study, there was 1 dog in the placebo group and 1 dog in the 3 times Zenrelia dose group who did not have adequate responses to only the distemper component of the 1 vaccine. All the dogs had an adequate response in every group to rabies, adenovirus, and parvo. All of that said, we can't ignore the results fully from the first study either, because we don't know if there was any role that Zenrelia played in those results or not. Because of this, the manufacturer currently recommends that 1 to 3 months before your dog needs any boosters, that they come off of Zenrelia, and then 28 days after their vaccine booster, they can start taking Zenrelia again. And of course, we only give Zenrelia at the label dose to dogs who are 1 year of age or older. This is in an abundance of caution because we do want our dogs to properly be protected from the diseases that we vaccinate them for. The last research study that we will cover is the one that was looking at dosing safety. This study found that at the therapeutic dose, there were no observable significant clinical changes noted in the animals. At higher doses, we did have some minor changes noted in blood work, but all of these would be expected findings for overdosing a drug from the JAK inhibition category. Now, we don't have long-term data on this drug yet because it is so new to the market, but we have had Apoquel on the market for quite some time now, and we anticipate that the other risks and side effects will likely be very similar to those of Apoquel. Most commonly, you can rarely see an opportunistic infection that will pop up in dogs receiving a JAK inhibitor. I think about things like Demodex or interdigital furunculosis, as well as issues like pneumonia. So patients that have some of those pre-existing infections may need to not be on Zenrelia until that has been resolved and dealt with. Of course, like with every medication, veterinarians are charged with careful case selection and considering the quality of the life of the patient without treatment versus with treatment, and we are supposed to be informing clients of things to watch out for and be aware of whenever we start any sort of medication. Your veterinarian may be checking some blood work panels if your dog is on Zenrelia. This is because sometimes we can see a drop in values like white blood cell counts. We also suspect that there might be a slight increased risk that dogs might develop some cancer with chronic use of Zenrelia. We don't know if this will happen for sure, but it is a potential, and your veterinarian will discuss what sort of screening is appropriate for your individual dog if you are using a JAK inhibitor medication. Now, of course, hearing about all of these side effects can be quite scary, and I very much understand that response. I also would encourage you to remember that veterinarians do not just prescribe medications on a whim. When we have animals that are dealing with significant allergies and itching, these animals are truly suffering and experiencing a significant disruption to their quality of life. It also is disruptive to the bond between people and their pets. Dealing with a dog who has allergies is patience testing and expensive and time intensive and stressful and frustrating. And then also the pet and the people tend not to be sleeping well through the night, so we get to add some sleep disruption and decrease in sleep overall into the mix. It's a tricky situation to be in, and I have all the empathy in the world for my clients and patients who are dealing with allergies. This is why it is so important to judiciously use medications like Zenrelia when we have a patient that is in need of them. I'm very grateful to have another tool in my toolbox because some animals who didn't respond well to Apoquel have responded to Zenrelia, and the relief that the pets and the people experience when they're having their disease better controlled is palpable. So a JAK inhibitor like Zenrelia will not be the right answer for every animal, but it may be an appropriate one to discuss with your veterinarian or with a veterinary dermatologist if you are struggling with a dog who is itchy. Zenrelia wasn't yet on the market when I made my previous videos on atopic dermatitis, so I hope that this little update was helpful for you. If you have a topic you want me to cover in the future, please comment it down below. I always love to hear from you. If you have any questions, don't hesitate to ask them. I do my best to answer everyone that I can. We do put out a video most Fridays through the summer. It may be some every other Friday. We'll have to see how things go. I'm currently struggling. I'm sure you've been watching the bags under my eyes grow over the last few months, but I will do my best to keep up with video releases as regularly as I am able to. I hope you all are taking care of yourselves, and I look forward to seeing you in the next one. Okay, bye-bye.